Hello and welcome. This is Health Day News. Thanks for joining us. I'm Mabel Jong. According to a brief published by the CDC National Center for Health Statistics, 10.7% of U.S. adults used one or more prescription pain medications in 2015 to 2018, with 5.7% using one or more prescription opioids. Next, according to a research letter published in the Annals of Internal Medicine, African Americans are underrepresented in clinical trials leading to approval of cancer medications. The researchers found that during the study period, 7.44% of almost 62,000 patients enrolled in clinical trials that resulted in subsequent U.S. FDA approval for cancer drugs were African American. Next, a study published in General Hospital Psychiatry shows that many New York healthcare workers are experiencing COVID-19 related psychological distress, especially nurses and advanced practice providers. Researchers found that positive screens were common for psychological symptoms. 57% had acute stress symptoms, 48% had depressive symptoms, and 33% had anxiety symptoms. Healthcare workers have faced unique challenges during the COVID-19 pandemic, including maintaining their mental health. In an HD Live interview, we spoke with Dr. Dawn Mordecai, National Mental Health and Wellness Lead at Kaiser Permanente, about how the COVID-19 pandemic is impacting these workers and what advice he has for them to keep good mental health as they work on the front lines. Here's what he had to say.
When we're talking about people who are, especially in the healthcare space, emergency medical responders, things like that's a group where there is real risk for post-traumatic stress disorder, depression, anxiety disorders, substance use disorders. I mean, we're all at risk of those things always in society, but now for frontline workers, it's particularly risky. I think in their case, leaning on the supports around them, taking care of each other, looking to their teammates, checking in on their teammates. Sometimes the best way to take care of ourselves is to look after other people.
Lastly, a surprising new study found that social distancing during the COVID-19 pandemic has not led to an overall increase in loneliness among Americans. Here's more on that topic.
Social distancing during the COVID-19 pandemic has not caused an overall increase in loneliness, according to a new U.S. study published in American Psychologist. Researchers surveyed 1,545 American adults 3 times, in late January and early February, in late March after a national emergency was declared, and in late April when many stay-at-home orders were in place. No significant mean-level changes in loneliness were observed across the 3 assessments. In fact, participants perceived greater support from others during the follow-up period. While older adults reported less loneliness overall, they experienced a temporary increase in loneliness during the acute phase of the COVID-19 outbreak. The study authors write, despite some detrimental impact on vulnerable individuals in the present sample, there was no large increase in loneliness, but remarkable resilience in response to COVID-19. The lead author says it will be important to monitor mental wellness as time goes on, especially in those who are older or have chronic health conditions that may limit their face-to-face contact as states reopen.
And that's the latest from Health Day News. I'm Mabel Jong.